Good afternoon. I'm here with Ed Shanshala, CEO of Amanusa Community Health Services. Good afternoon, Ed.
Good afternoon. Thanks for having me.
Appreciate it. Can you give us a brief background or history on how Amanusa Community Health Services got its start?
That's a great place to start with the inception of Amanusa Community Health Services. It is a mouthful, and as we've moved forward, we've chosen to, you'll often see it in the public as ACHS.
Right.
It's easier to get over the phone. But in 1975, the community realized there were some needs in the community. And so 2 staff, community members, and $12,000 started, at the time, what was a family planning clinic. And over time, by the time we get to 1994, it becomes a federally qualified health center. And the original federally qualified health center included a care delivery site in Littleton at Mount Eustis and Cottage, and a care delivery site in Warren, New Hampshire, that in fact had been a community health center since 1957 in an old Boston and Maine rail station, and that health center is referred to as the Mount Moosilauke Health Center, in part because of its location. And in '94, the federal government decided that it was a smart investment to help us help those who did not have access to health care, and at times not only didn't have access because of geography, but sometimes because of affordability, and that's how the inception started. When we move up to today, which we're just a year shy of our 40th anniversary, we're now out to a $9 million budget, 5 care delivery sites, 90 staff, about 10,000 patients see us, and they see us about 30,000 visits a year.
Wow. And the range of medical services that you currently provide, and maybe after that you could touch on the new dental initiative that you've taken on.
Yeah. So over the course of time, as the board of directors and senior leadership have looked at community needs, they've looked for opportunities to expand services. And so starting with medical in 1975 and continuing in 94, in between 94 and 98, behavioral health services get added to the complement of services that we offer. And in 2011, we added integrated pharmacy and clinical pharmacy services, and we have 5 care delivery sites. The pharmacy is located at our Littleton site. And we've looked at how to increase access to oral health care for patients who currently don't have access, they don't have a dentist, and we're just starting the renovations in our Littleton facility at the corner of Mount Eustis and Cottage Street, and we think, God willing and the creek don't rise, that August we'll start to be able to see some patients and help them get the care they currently don't have access to.
I've also been looking at your website and see that you're heavily involved in the community. Can you talk a little about your community involvement in things other than the healthcare provider? Well,
yeah,
sorry, I said that wrong.
Oh, absolutely. When we look at people come to us for a variety of reasons, some it's preventive, some is planned care. If you're a diabetic, you may see us more frequently so that we can work together and have your diabetes where it needs to be managed. And we get out in the community in fostering people's individual and community health and wellness. And one way that we do that is with our Amanusa 5-mile walk run. It's the Amble, and last 2 years ago we rebranded it as Miles for Smiles, anticipating that we wanted to use it as a way to get people out to be healthy and kick off the spring, and also bring attention to the importance of access to oral health. And so those monies that we raise, and we raise about $15,000, goes into oral health care for people who otherwise would not be able to get it.
Well, it was a great idea, and I understand it was a very successful event, albeit the weather wasn't spring-like.
Yes, it's grown significantly through the years. In its early days, over 20 years ago, about $2,000 were raised in people who participate in sponsorship. We've now up to about $15,000, and that's been very helpful. We've added a kids fun run. It's a short mile run. They seem to enjoy that, and some people run it, some people walk it. It goes down the old Gilmington Hill Road, old Franconia Road. So you have these beautiful stone walls, and usually there's still little snow on Lafayette and Cannon. So visually, it's a very nice walk, or if you're so inclined, it's a very nice run.
And sorry. And lastly, can you give us an idea, or specifically, of what your locations are throughout this community?
Yes, we have. If we look at our service area, it includes 26 towns in the North Country, in northern Grafton and southern Coas, where 30,000 people reside. And we have 5 care delivery sites. We have Whitefield to the north, Littleton, and Franconia. And those patients who get care there, if they need hospitalization, we work really well with Littleton Regional Healthcare. So it's a really nice collaboration with LRH. And then in the southern part of our region, we have Warren and we have Woodsville. And those patients will often, if they need acute care, will go to Cottage Hospital. And likewise, the relationships between us and our local hospitals and our home health and hospice are really quite exceptional, and there's a fair amount of collaboration and innovation going on in those areas.
And as North Country Local News, just getting our start and enjoying a relationship with you, how do you see bringing the information to the public as we move through different seasonal issues?
Well, I think that when patients come to us, they get value from a variety of our medical, behavioral, pharmacy, and in the future, our oral health providers. I think we have an opportunity to bring that knowledge to the community, and so I'm hoping that over the future that we can bring our content experts into a conversation that the community can benefit from. I know that as we move into summer, we're all familiar with the ticks in the North Country and the black flies, so we do put brochures out to help people get educated on ticks and what to do about them, how to prevent them, if you get one, what to do about it. And I know that sun is late to come to the North Country, but when it comes, you can still get a sunburn, and helping people understand how to protect themselves with that. I think we can bring content experts that better enable the community to be mindful and to take actions that are good for their health and their wellness. And it's really helpful for us to have a community that's healthy and well, and the more knowledge they have, then they can make really smart decisions.
Well, Ed, thank you so much for coming in. Ed Shanshala, CEO of Amanusa Community Health, and we'll look forward to hearing more information and more content about how we can better protect ourselves and take better care of ourselves.
Great, thank you very much. Appreciate you having me in.
Thanks. Scott Miller for North Country Local News.